One very important part of pain relief for a nurse is the pain assessment. And your book talks about this on page 213. We have to be able to assess the patient's pain. We have to be able to record it. We have to try to relieve it. And then we have to document how we attempted to relieve it. So this is, you will find a large portion of your career taken up with pain assessment, pain treatment, and pain reassessment. I just thought that was kind of amusing if you've ever had kids and stepped on a Lego. All right, so you're probably familiar with the pain measurement scales. And these are found in your book on page 213. And there's several different scales. As nurses, we're usually most familiar with the numeric pain intensity scale. You come in and you talk to your patient and you say, on a scale of 0 to 10, with 0 being no pain at all and 10 being the worst pain you've ever had, what would you say your pain level is? 4 and 5 is considered to be moderate pain. Generally, hospital protocol will dictate that you want to treat a patient when their pain gets to be at a level 4 or above, usually with something stronger. And this is an imperfect scale because people vary so much in their response to pain. You're going to get a person who's laughing, talking, chatting, eating, on their phone, visiting with family members, appears to be just fine, but they said their pain is a 10 or 11. And who's to say it isn't? It might be the most unbearable pain they have ever experienced, and they're just trying to put on a brave face so they don't upset their family members, or they're trying to distract themselves. On the other hand, you might get somebody who is lying frozen in the bed, clutching the sides of the handrails, knuckles white, sweating, breathing fast, looking absolutely miserable and insisting that their pain's only about a 2 or 3. I don't need anything. So everyone's reaction to pain is going to vary based on so many factors. And so the only thing we can do is to take a patient's word for it, just to take them at face value. We also see a couple of other descriptive pain scales, and these are maybe for people who don't react as well with numbers. Some people are more verbal, they're more descriptive, and you can show them, here on this picture, you see that the more blue there is, the less pain you suffer. The worst possible pain you can imagine is sort of a bright red. Can you show me where your pain falls on this scale? Sometimes you can do the same thing with that visual analog scale, no numbers, no words, but just have them move up the scale and show you where they think the pain is. And all we can do is treat them based on what the patient says. This has had a lot of good effect. This is called the Wong-Baker FACES pain rating scale, used both with children and adults. And recently, it has been used with great success for women who have endometriosis. Recognition of the extreme pain and discomfort suffered by women with endometriosis has been a very long time coming, mostly because the medical world was so male-dominated at one time. Now, half of physicians are women, and so you're getting a little bit more recognition of the intensity of female-type pain, and there's more of a focus on the pain of endometriosis rather than just trying to look at it as purely a fertility issue. And you can see here that on the Wong-Baker FACES scale, we've got a really smiley-looking face where nothing's hurting at all the way down to an extreme frowny face with tears. And many times this helps to show a child or even an adult who might find that a little bit more comfortable, a way that they can express their pain without really having to put it into specific words. One thing you might have to use is the FLAC scale. And I'll let you look at your particular PowerPoint slide for this because it's not real easy to see. But the FLACS scale measures face, legs, the patient's overall activity, crying, and consolability. And it is used when the patient's ability to report their pain is not possible. And this is found in children from about 2 months of age to 7 years, or adults who are either intubated or in a state where they're really unable to verbalize their pain. Then it puts the responsibility for us to look at the various rating areas of the FLACS scale and determine the best we can what kind of pain this patient is experiencing. So it's more of a behavioral assessment scale for pain. So the way you use it is you have to observe the patient uncovered for 1 to 5 minutes if they're awake. You want to observe all their legs, their body movements, how they position themselves, overall activity. Are they tense looking? Are they relaxed? And are you able to console them? For a sleeping patient, it's the same, but you have to observe them for more than 5 minutes. Then you have to add up the various aspects of the scale. How are they behaving? Are they able to be consoled? Are they sleeping peacefully and comfortably, or are they exhibiting discomfort in their sleep? And you add up all the numbers. If there's 0, if 0 is your result, they're considered to be relaxed and comfortable. 1 to 3, mild discomfort. 4 to 6, once again, moderate pain. And then 7 to 10, severe pain or discomfort. And then we are told to treat the patient accordingly. Now, what is the process for pain? You can see that this person in this picture is about to be in a world of hurt in just a second. And so what is the actual process by which we experience pain and then perceive it in our brains, our pain centers? So the factors that are said to produce pain, starts off with an unpleasant stimulus that affects nerve endings and sets off electrical activity. And thinking of the previous slide with a person about to step on several push pins, you can see that that is certainly an unpleasant stimulus. It's about to affect the nerve endings of the feet, and that's going to set off some electrical activity. Once that happens, those electrical signals are going to pass that stimulus along to nerve endings in the spine. Those nerve endings in the spine are going to carry signals to the brain, and the person is going to realize that they have indeed run into an unpleasant stimulus. Then, based on years and years of conditioning and cultural background and stimulation in a variety of different ways, the person is going to have a behavioral, psychologic, and emotional response that could be anywhere from them grabbing their foot and clenching their teeth and stoically refusing to display pain, to them screaming and hopping around and declaring to the heavens in all kinds of colorful ways how much pain they are experiencing. And there's a huge spectrum of responses that are going to come into play after an experience like this. I'm going to stop here, and we're going to review tolerance, dependence, and addiction, which we've discussed before, but it bears repeating.